Is your hair getting thinner, drier, not quite the same since you've gotten over 40, and maybe you've been told your thyroid's fine, your hormones feel pretty good, and yet you're still losing a lot of hair? In fact, you feel like you're losing as much hair as the family dog. Well, it could be your iron. Have you checked your iron? I mean, have you really checked your iron the proper way? And that's what I want to talk about today. You see, hair loss and iron, even suboptimal iron, they go hand in hand. But a lot of women are just getting a CBC, which is a complete blood count, and told it's normal. And I put normal in air quotes, but they're still losing a ton of hair and not really sure what's going on. But the problem is you're not getting iron where it counts, which is at the hair follicle. And iron plays a big role in your hair follicle. So today, I'm going to show you what's going on with iron. How do you test it? What are the symptoms? What are the causes? What do you do about it? And then I'm going to touch on at the end other reasons for hair loss because, of course, you can have more than one thing happening at the same time. So if you're over 40 and you're losing hair more than you're losing your patience, listen up. Let's get going. First and foremost, symptoms of low iron. I just want to jump in with that before we get into labs. Symptoms. Fatigue is a big one. Now, you might be thinking, fatigue covers so many things. I know, but here's some others. Shortness of breath. You notice that all of a sudden you go to walk up a hill and you're like panting. You go to run up your stairs, panting. Working out at the gym, you're like short of breath and you're not at a high level. You're not on a mountain. You haven't like changed anything. Like, you know what I'm saying? You didn't go from, being at sea to being up high and high altitude. You're just at your house. You're just at your normal gym. You're just at normal. And all of a sudden you're like, why am I so out of breath? You may notice you're more pale. So your skin is more pale. Or if you have a lot of melanin, then you may notice the palms of your hands when you pull down on your eyes. That's the conjunctiva, more pale. Maybe your tongue is more pale. Your gums are more pale. Just enough that you're like, that's interesting. I wonder what's going on. Again, hair loss, that's a big one. Dizziness, headaches, especially when working out, restless legs, brittle nails. Yes, all of these could be an indicator of low iron. Iron is really important for a lot of things, but it is part of moving oxygen all around your body. So if any of those symptoms have got you thinking, wait a minute, yeah, I have been having more of that lately, or I just thought it was getting older. I just thought it was part of perimenopause. It could be iron. So how do we test it? CBC is the first thing everybody runs, complete blood count. This is where we look at your red blood cells and your white blood cells, which is great. If you are full-blown anemic, it's going to show up there. If you're fighting an infection, it's going to show up there. Now, if you're not full-blown anemic, but you're just like kind of low iron, it may not show up there. And a CBC is very cheap to run. It's generally completely covered by insurance. And so that's the screener test. Now, unless you show up with any of these other symptoms, or unless you show up with heavy bleeding, that's what you report to your healthcare practitioner, they may not run the additional markers. They may just stick with the CBC and go, yeah, it's normal. But we want to look a little bit more than that. So we want to look at again, a full iron panel, but specifically, I want to look at things like ferritin. Now, ferritin is a marker, let's say, of like iron storage, and ferritin tends to decline first when you're losing iron or your body is moving iron, like hiding iron. Ferritin long has had a very wide reference range. The reference range, depending on the lab that you use, but on average, the reference range would be from about 15 nanograms per ml all the way up to 200. I'm not kidding, which means I would have women come to me and say, my ferritin is 16. I was told I was normal. Well, 15 was the cutoff. Now, on the way other end of the spectrum, I've had women tell me, well, I was at 190 and 200 is the cutoff. And I was told that was normal. I'm like, neither of those are normal. I mean, sure, they're in the reference range, but like, come on now. So I've long maintained that ferritin should be much higher than 15. And here's what's interesting. The American Gastroenterologic Association, along with the American Family Physicians, said, yeah, it should probably be higher than that. So they changed it and they made the guidelines to say above 45 is ideal. Under 45, and we're looking at an iron problem. Sometimes you will see less than 30 as an iron problem, but labs haven't caught up yet. So if you're using your regular old lab at your hospital, Quest, LabCorp, like the big ones, they will probably still be 15 when the guidelines are changing to be more like 45. This is a big gap. Because if you are between 15 and 45, that's not good. Those two associations are saying, well, you probably have an iron problem. So I think a lot of women, I know a lot of women have been missed in their iron for decades and decades. And it's something I've long been saying with a lot of pushback, because I would see somebody with a ferritin of 16 or 20 or 22, all the symptoms, they're super tired, they're losing hair, their nails are brittle, they have restless legs, they're weak, they're short of breath. We get them on iron, we get their iron back, we address the cause, and they're like, oh, I feel so much better, thank you. But yet maybe their primary care pushed back and said, I don't understand. Their CBC is fine, their ferritin is normal for that reference range. And it's so frustrating. Now we can add in other markers. You can check literal iron. The iron is part of the iron panel, so we can see what your iron is doing. We can check something called the TIBC, total iron binding capacity. We can check what's called a percent saturation. And these just give us more data points to figure out what's going on with your iron. How bad is it? What else might we be looking at? Now, there are other forms of, let's say, anemia. You could be B12 anemic. You could be folate anemic. You could be anemia of chronic disease. There are a lot of other forms of anemia. Oftentimes, when you hear people say, I'm anemic, or I was diagnosed anemic, I was told I was anemic, we sort of umbrella term generically the word anemia to mean iron, but do know that the word anemia does encompass other forms of anemia. You don't have to be full-blown iron anemic to have suboptimal levels of iron in your body. You could be less than 15. I've absolutely had people at a 9 or a 5 or a 4, God bless them, like, woof, were they tired and were they losing hair? So we start there when we're looking at a full-blown iron panel. So make sure if you have any of those symptoms, you're kind of concerned about your iron, ask. Oh, the other symptom I didn't mention, bruise easily. I can't believe I forgot that one. Bruise easily. So if you are having the shortness of breath, you're having the weakness, the fatigue, the hair loss, brittle nails, bruising easily, restless leg, even a faster heart rate, start to, things that make you go, get your iron checked. Get the whole thing checked. Now let's talk about causes. What might cause you to have low iron? Well, obviously, if you're not eating it, if you don't eat meat, you don't eat iron-rich foods, it's totally possible you're just not getting it in, especially if you're not supplementing or eating other types of food to help get more iron into your body. If you are not absorbing it, so let's say you have H. pylori, which is a bacteria that can live in your stomach and get in the way of absorption. Let's say you have celiac disease, or you've had celiac disease and you just recently found out. Let's say you have SIBO, small intestinal bacterial overgrowth, ulcerative colitis, Crohn's. You just happen to have poor overall absorption. You just don't absorb foods very well because your gut's been a mess for a while and you're working on that. Well, that's a good reason your iron is probably pretty low. There are certain medications that can cause iron to go low. So definitely look up, like, oh my gosh, is it possible I'm on any of these medications that might block the absorption of iron? If you're taking iron at the same time that you're taking like fiber, for example, or calcium, then those can knock each other out. They can block each other. Antacids are another great example. If you're taking antacids, at the same time that you're eating iron-rich foods, or maybe you're taking your iron supplement, you've got to be careful. Now, another reason is bleeding, which is super common for women. Are you bleeding? Do you have heavy periods? Now, you maybe didn't have heavy periods growing up, but once you hit perimenopause and your hormones went chaotic, you're like, what in the heck? It is a gusher all the time. Or maybe you're having 2 periods in a month. So your bleeding is expected. It's not like that heavy, but it's twice a month. And that's like, annoying for one. But 2, that's a lot more blood that you're losing. So you could be transitioning into low iron just because the shift in perimenopause is causing you to bleed more. If you have hemorrhoids that are bleeding, like, we have to get that evaluated because that's blood leaving your system. If you have ulcers can cause bleeding. If you have certain chronic disease, depending, they can have low iron. Now, typically they have normal or high ferritin, but we have something called anemia of chronic disease. And so this is why I mentioned earlier, there are more than one types of anemia, and we can't just blame everything on iron. We have to work it all up, because it's also possible you have 2 things happening at the same time. You could have anemia of chronic disease and be iron deficient at the same time because, your periods are heavy or whatever. You're vegan or vegetarian, or you just found out you're celiac disease and shouldn't be eating gluten. So your absorption has been bad for a while. So when we look at these reasons, do know you can have more than one, right? You for sure can have more than one symptom. You can have more than one cause. And this is why the lab part is important. This is why understanding what's going on is so critical. Now, how do you address it? Do you just take an iron supplement? Do you go get an iron infusion and get your iron up there again? Well, the answer is maybe. And it depends how low and bad things are. Also, it depends why it's low. So, first and foremost, we want to address the cause. If you are having super heavy periods, and remember, heavy periods can be due to perimenopause, like I mentioned, but they can also be due to fibroids or polyps or hyperplasia, God forbid. So, we want to make sure I'm figuring out the why. Why are you bleeding so much? If you're bleeding out the other end, I'm like, is it hemorrhoids? Is there something else going on? Is it from your stomach? Do you have ulcers? You might want, how's your stress been? Are you been like living on antacids because your stomach hurts all the time? Is it because of malabsorption? I had a doctor friend of mine tell me recently that she got a bunch of blood work done, found that a lot of her nutrient markers were super low, iron included. Turns out, she said, I can't do gluten. She found out this whole time, her whole life, had no idea that she couldn't do gluten. And what happens, especially in celiac disease, is celiac disease will shear down and impact your intestine's ability to absorb nutrients. So instead of having these lovely, flowy finger-like projections that can suck nutrients in so you can absorb them, they get sheared down. They're very flat. They're not like finger-like projections, and then you can't absorb. So not only are you not going to absorb iron, but you don't really absorb much else. And the same goes for people who are like, ulcerative colitis, Crohn's, even significant IBS, irritable bowel syndrome. While it's not the disease part, ulcerative colitis and Crohn's are called IBD, inflammatory bowel disease. IBS maybe is just so bad, so inflamed itself, so leaky that you're not absorbing any of these nutrients. So you can see, like, how, Carrie, can I just go on iron? I'm like, well, maybe, but I have to figure out your cause first. And as usual, you can have two things happening at the same time. You could have three things. You could have hemorrhoids, yay. And then you could have heavy periods, like, what? And at the same time, you may find that you have stopped eating iron rich foods. Maybe you used to eat meat, beef, steak all the time, and whatever reason, you've cut way back and you're not really doing that anymore. So you can see, all of a sudden, we can have an iron issue build up very quickly. Now, let's talk about other reasons, because as I said, iron is just one of them. And I want you to be able to be aware, yes, you're going to get a full iron panel. Yes, you're going to look at your ferritin. Yes, you're going to make sure your ferritin is above 45 for sure. But what else could be going on? Okay, thyroid is a big one. Now, I mentioned the very, very, very beginning, some of you are like, my thyroid is fine. Make sure you do a full thyroid panel as well. So TSH, thyroid stimulating hormone, free T4, and free T3. Free T3 is very, very important. It's what makes things go round. It does the thing. It's in the hair follicle saying, make and grow the hair, activate, do it. So sometimes TSH is the only thing tested, and then T4 will sometimes be tested. And nobody really tests free T3 unless you understand how free T3 works and the importance of it. So push for a free T3. So if you have even suboptimal thyroid, even if your TSH is normal, but your free T3 is low, you can have hair loss, because the free T3 is the one that it's the show pony. It's the one that does the things. Other reasons, androgens, think of like testosterone, DHT, dihydrotestosterone, DHEA, which will turn into these things. These are the androgen family. And when you have higher levels, actual higher levels or perceived higher levels, guess what? At the hair follicle, you can have hair loss. Interestingly, you can have hair growth, though, in places you don't want. So it can stimulate hair loss on the head, but hair growth on the chin or down the neck or on the upper lip. Like, who thought of this? What? Okay. Yes, it's true. So PCOS is the most common, polycystic ovary syndrome. However, a lot of women head into perimenopause and their ratio between testosterone and estradiol becomes off. They become more androgen sort of dominant. So they're not PCOS. Just to the body, the body's like, whoa, where did estrogen go? So, but there's a lot of testosterone left over, and that can cause hair loss on the head for some women if their hair follicle is really sensitive. So, do know these big hormone changes in perimenopause for sure can impact the hair follicle. Not everybody goes through these changes, but like a lot, enough that I want to bring this up. This change, this perceived change, because remember, your testosterone may not decline at the same rate as your estrogen. You may have perfectly fine levels of testosterone as your estradiol plummets. Well, that's a big, change between the ratio. So the body's like, hair loss. Sorry, you get hair loss. And that's what can happen. Now, another reason, of course, cortisol or stress. Usually takes about 3 months for that to happen. So if you had a big stressor 3 months ago, you had a big project, God forbid, we're going through a divorce, somebody was sick, you were sick, there was something major moving, some big upheaval, change of jobs, whatever it was. About 3-ish months later, women start to say, I'm shedding a lot, like a lot. And that's different than low iron. And two things can be true at the same time. You can have low iron and have gone through a major stress, and like boom, boom, you have all this hair loss. So do know cortisol absolutely plays a big role in hair loss. Hair products. Have you switched hair products recently? Have you moved or changed your water recently? Hair products, changing hair products, your shampoo, your conditioner, your mousse, your gel, your hairspray, your thick, whatever you've got. Maybe you're using a new salon. Maybe you're getting, your hair done with a different person. Maybe you've moved homes, and so the water in your old home was fine, but the water in this new home is harder or softer, or has more minerals or less minerals, or whatever, is on well water, but you weren't on well water. And all of these can impact the hair follicle. The hair follicle is like, oh, this is a change. I don't like this. And you can have hair loss. So evaluate that. If you have any kind of decline in minerals play a big role in the health of your hair follicle. So make sure you're getting in enough minerals. Obviously, we've been talking about iron, but like you have a whole lot of other minerals that play a role in the health of hair. Also the health of nails, right? Like we talk about hair, skin, and nails kind of together. They definitely work as a team, so to speak. Medications. Certain medications can impact hair loss. The big one being, of course, chemotherapy. But if you're like, no, I haven't had chemotherapy, think of things like antidepressants, certain antidepressants. For example, if you've recently gone on or shifted your dose of Prozac or Zoloft and noticed hair loss, that actually can do it. If you've gone on or off or changed the birth control pill, that can do it. It's a big shift in hormone. So that could potentially change it. Even if you went off the birth control pill and had an IUD inserted, or if you were on a certain type of birth control pill and they switched you to a different type of birth control pill, that shift in hormone can do it. Or maybe you're like, I don't want to do this anymore. You went off the birth control pill and started hormone therapy. That shift can do it as well. Now, again, the whole goal is like with these shifting, the hair follicle will calm down. But sadly, the hair follicle does not work at the speed of light. It doesn't work how fast you would like it. You are probably type A, overachiever, get things done quickly. Your hair follicle is not. It's definitely type B, takes its time. So it's going to take some months to get over the change that has been happening. Other medications are like steroids. Prednisone is a big one. So if you had to, let's say you got stung by a bee, or you have an autoimmune condition and you had to go on a prednisone pack for something, anything that would have you on either a short or even a long course of steroids, it can affect hair as well. And then lastly, testosterone. So if you went on testosterone, maybe you went on a lot to start, it's possible it could shift that ratio I talked about earlier and can cause hair loss. So if your prescriber jumped you into a lot of testosterone and you were like, oh my gosh, it doesn't mean you can't do testosterone. It just means you probably need a way lower dose to start and then sort of work yourself up, because the hair follicle's like, whoa. I will also see this if women do testosterone. Like if you need testosterone and estradiol and you opt just to start with testosterone, I will see hair loss a little more with that, because again, you shift that ratio in favor of testosterone over estrogen. And then they'll be like, oh, I don't like testosterone, I got hair loss. I'm like, ooh, you still might benefit and need testosterone, but we have to rethink the order that it is prescribed and used in. And some women, that's why they like do it at the same time, or they'll start with estrogen first and add testosterone in second. So just be mindful. And again, I don't want to worry anyone with testosterone, because a ton of women go on testosterone and have no hair issues whatsoever. However, if you are not that person, if you were thinking, nope, that was me, I went on testosterone, hated it, lost hair, possible it was too much, possible it was the wrong order relative to estrogen and caused that kind of crazy shift up in the hair follicle. So hopefully that helps you understand hair loss and iron. You're going to ask for your ferritin to be checked. You want your ferritin to be over 45. You're probably going to ask for a full-blown iron panel. What's your ferritin and what is your iron? Your TIBC, your percent saturation. You're still going to get a CBC, complete blood count, because that's usually always the basic of what they run. You're going to look at causes. Is it possible you're not eating it? You're not absorbing it. You're bleeding a lot. Are you on any kind of medications or things that would block absorption? Like what's going on that you don't have a lot of iron? Where's it going? And then it's not always iron. It might be iron for sure. It might only be iron. But now you're going to look at these other reasons for hair loss. Is it possible it's androgen issues? Is it possible it's thyroid issues? Is it your products? Is it your water? Have you changed hairdressers recently? Have you moved? Is it minerals? Is it stress? Is it any of these medications that could do it? Have you recently started or stopped anything in the last 3 to 4 months that could bring on hair loss that we're not anticipating? Whew. Hair loss is a big deal. Remember that hair loss, especially in relation to stress, hair is not seen as critical. I think it's critical. I am a big fan of hair. I'm a big fan of my hair on my head. Thanks to my father, I have very thick hair, and I'm hoping, knock on wood, that I get to keep this very thick hair. But when there are major stressors, major changes to the body, and the hair follicle perceives that there's a big time changes, hair growth is not the priority. Things are going to get rerouted to other more important things like your heart, your bones, your brain, your liver, like your organs. Like those are where the resources are going to get rerouted to. This is why people get so frustrated, and I fully understand when somebody says, why can't I just grow hair? I'm like, it's possible. It's possible because it's not a priority. The body is rerouting for survival. So we have to address all of these things. We have to turn over all of these rocks and figure it out when it comes to hair. Hopefully that helps you, give you a starting point, where to ask your healthcare practitioner what to order, what to look under, what rock to look under, and then all the other things besides iron that it possibly could be. Because I know hormones feel like herding cats, and that includes hair and iron and all the things that go with hair loss.